Welcome back. Thanks for staying with us. The Health Department is appealing to the public to vaccinate, get booster shots and observe non-pharmaceutical interventions as it probes the severity of the new Covid-19 XBB.1 variant. Health experts at the World Health Organization have called the variant the most transmissible subvariant detected thus far. South African Medical Association's Dr. Mvuyisi Mzukwa joins us for more on this. A very good evening to you, Dr. Mzukwa. Thank you for your time. Is there cause for concern? I mean, all of this information sounds very frightening.
Good evening to you, Mpo, and to your viewers, and thanks for having the program. We are aware, the South African Medical Association, that there is a variant that is very transmissible, most transmissible than what we have seen in the past. But it's not a cause for concern. We just have to be cautious. As far as we know, scientists are working on it to understand, how it behaves and further development. But all we know so far in the countries that have been affected by this is that there is no surge in hospitalizations. But if you come to the context, South African context, we know that more than 90% by now have been exposed to the virus and they have natural immunity, but also there is the issue of vaccination. But we still encourage our communities to go out there, especially those that are referred to as vulnerable groups. They need to go and vaccinate, those that have underlying medical conditions, regardless of their age, but also those that are 50, 60 years above, they need to go for a booster shot.
And in terms of really just understanding some of the interventions, I mean, you speak about booster shots and all those precautions that need to take place, but when it comes to maybe understanding this variant, how much information is there at present about where it may hail from and what it is?
Well, we all know that already it's in about 28 countries. Is more dominant in the U.S. We've already had news that South Africa is one of the countries now that this variant is circulating in. But all we know so far is that even though there's a, it looks very easily transmissible, we understand now that there is no surge in the hospitalizations, which talks to severity of the condition or even death. So there are no complications as far as we know that would lead people to be hospitalized. But having said that, we do need to be cautious in terms of how we conduct ourselves, because we do know now that we've learned from the past. We know that you've got to avoid crowded areas, making sure that the area that you are in is well ventilated if there's many people. So we've got those public health measures that we've learned from the past. So I do believe that we are now ready. We know what to do should anything happen. And I'm sure our scientists in the country are working hard, to understand the variant.
Without sounding the panic button, you speak about how we've learned from public health measures in the past. Do you think that this would now begin to be an appropriate time again to wear masks?
Well, it has been a recommendation that if you are symptomatic, you need to protect others. You need to make sure that you wear a mask. Even if you have a simple flu, it is important that you protect, people around you. But obviously, if you are going to be going to crowded areas, I mean, there's a surge of COVID cases, you must put on your mask. If you are getting into a plane, why not put on a mask? Because you understand that those areas might not be very well ventilated.
We were also recently learning of what's happened in China, South Africa, being told by experts who have said that South Africa is unlikely to face a fresh COVID-19 outbreak. on the back of what's happened in China, and South Africa is not taking the interventions that are being taken in countries such as France, Italy, Canada, and so forth. How much do you think that information from learning of the cases in China and what could happen in South Africa will assist perhaps in navigating around this latest outbreak?
Well, we know that there is not much information that is forthcoming from China. But also we know that, the previous measures that were taken by countries of restricting travel and stuff like that, it did not work in the past. We all know that when they do that, the variant, you will find the variant within the borders of the country. So I don't think we should be going back and, punish China and the other countries that are having a problem now. Something that was done to South Africa when we're honest about, our discovery in terms of the Omicron. So I do think that even this time around, let us not waste time, disturb the economy on things that did not work in the past.
Very well. Thank you so much for that. South African Medical Association's Dr. Mvuyisi Mzukwa.